In this segment, I want to talk about FLD, frontal lobe dementia. Some ALS patients, there's argument about or discussion about what percentage, but a reasonable percentage of ALS, bulbar ALS patients experience frontal lobe dementia. My wife had FLD, not initially, but certainly the last 6 to 8 months it became very serious. This is again another very, very, very difficult benchmark. With frontal lobe dementia, it's not a memory situation. It's not like Alzheimer's. Her memory was perfectly fine. She could remember anything. It's a processing problem. She can't process what she wants to say or write on a whiteboard or text any longer. So it's not Alzheimer's. It's important to understand that. Memory was perfectly fine. It's being able to communicate and process what she wants to say. Part of, as FLD gets more severe, I found that my wife had what I called, which we called in the Army, the 1,000-yard stare. She wasn't focused any longer. When you looked at her from her eye standpoint, she wasn't focused on anything, and she became more and more introverted. One of the first things that went is my wife always maintained the house checkbook, and if she was off by a penny, it would drive her crazy, and she would find the penny. And that was one of the first things that she had to give up because she couldn't maintain a checkbook. She couldn't do the addition or the subtraction and know which checks she had written, and it just became way too confusing for her. Eventually, she read a lot, and eventually with the FLD forced her down so that she was reading 1 page in a book an hour, and she would just sit there and try to focus and concentrate on reading that 1 page, and it became increasingly difficult. Another example of FLD is she would ask me questions out of the clear blue that didn't have any context to them. One day she wrote on the board, "You need to buy a present for Tyler." And I had no idea who Tyler was. I don't know anybody by the name of Tyler. And the reason why I'm mentioning this whole FLD process is it forces you into a 60-question kind of conversation with the pals, trying to figure out what it is that they're trying to get across from you. I went into I have to buy a present for Tyler. Who is Tyler? Where is Tyler? Where does Tyler live? What's Tyler's name? And she just had enormous difficulty trying to communicate what she was trying to say. It turned out that the person that she was talking about his name wasn't Tyler, and it happened to be a good friend of ours' grandson, but she couldn't communicate that any longer. So FLD, when it comes, is extraordinarily difficult for the caregiver. It's another horrible benchmark, and you're going to have to develop some patience to deal with the FLD, because the person that you knew is no longer able to communicate in a fashion that you were used to for years and years, and that they can't get their points across to you. So it's extraordinarily frustrating for them, and it's difficult for you, and you should be aware that it's possible that your pals will develop FLD.